And government continues to urge people to get vaccinated so that once the fourth wave hits, we'll be better protected. Let's discuss this and other issues with Health Minister Dr. Joe Phaahla. Thank you very much for making the time this morning to engage us, Minister. And just based on the fact that you've been leading the COVID-19 crisis management for a few months now, how do you feel you've been doing in that role?
Well, it has been a bumpy road. It's not been an easy one coming in when the third wave was really raging. But quite encouraging is the fact that down the line, the numbers started going down. But just from the experience of the last 20 months, we've been aware that this is probably just a temporary reprieve. And that's why we've been urging people that this is just the right time to take as much vaccination as possible, as many people vaccinated, because we knew it was just a matter of time that the next wave will be coming. Of course, there was a good uptake earlier on with the vaccination, but unfortunately, as people get more comfortable in a way that the numbers are down, and then you see the uptake on vaccination also going down. So that's really a worrying trend.
Right.
But I think we've tried to do our best in the circumstances.
Right, and we'll get into issues around the fourth wave in a moment. But yesterday I had an interview with Dr. Jo Barnes, who's an epidemiologist, and she's indicated that the problem around the vaccinations in the country is the poor messaging from government and related stakeholders. Your thoughts on the messaging around alleviating fears around getting vaccinated?
Well, I wouldn't mind maybe not live on the TV now for you to give me the contact numbers of the epidemiologists you're talking to, because we would like all assistance in terms of people who have better ideas in terms of the kind of messaging, because we would like to reach everybody in the manner in which they will be able to understand the message quite clearly, because at the end of the day, we really would like everybody to understand the significance of the protection which the vaccines are able to provide, so that more people can take it up, because indeed I mean, we have the capacity to administer the vaccines to all adults in the country. But unfortunately, as I said, the uptake was good in the beginning. It's been waning. So we would really appreciate anybody who's got ideas in terms of how that message could be improved.
Right, let's speak about that fourth wave now. Very concerning. Many experts indicating that it'll come sooner than January, just based on the fact that we've come out of elections, there were super spreader events. And also, very interestingly, there's been an increase in flu infections over the last few weeks, which indicates that South Africans are lax when it comes to things like wearing their masks and social distancing. What are experts telling you about the fourth wave and its severity?
Well, so far, what they're telling us is still that we should expect it earliest middle of December, possibly even later, towards the end of December and early January. Now, in terms of severity, the belief is that because of the three waves, although there's different variants, but many people have built immunity, but also with at least having breached the 40% of adults having received at least one dose, that even that will provide additional protection over and above those who might also be covered by natural immunity, because it's not known as to how long natural immunity would last. So there is an optimistic prediction that because of these factors, of course, depending on the nature of the variant, that the fourth wave may be less devastating than the first three waves. So that's an optimistic view. But we have had these optimistic views before, and when the waves came with the different variants, it's been quite devastating.
Right, and you have said that it's expected that it'll be less devastating than the previous 3 waves. But what will government's approach be in terms of dealing with the 4th wave? Are you confident that your healthcare facilities are prepared for any eventuality?
Well, Rofhiwa, it's very difficult with this virus. You know, I think anybody, anywhere in the world, who can claim that they are absolutely ready. I don't think, that confidence could be justified because, just from our own experience over the last 3 waves and also experiences studying what's happening in various parts of the world as we speak now in Europe, situation is quite difficult in very advanced, developed countries where, there's really a difficulty in containment. So we are doing everything to make sure that when it does come, that our facilities, that we are ready in terms of bed capacity, in terms of oxygen, in terms of staffing, all those things which are essential, ICU beds and so on. But the problem with it, as everybody, we're talking to all our colleagues in provinces, working with our national team to make sure that in all these aspects we are ready. But the problem, as you have seen in the last 3 waves, you don't even know where it's going to hit first, with what magnitude. So you get as ready as you can predict, but you never know where it's going to hit with what magnitude.
Minister, we are running out of time, and I've got a couple of things that I want to get through to you. What would be the Department of Health's advice to government when it comes to the implementation of lockdowns?
Well, we would want to avoid severe lockdowns. We are studying the developments every day, but we would want to do as much as it's possible to, in terms of social restrictions, to avoid super spreading, but without taking too much away from the liberties of people socially and economically. So we will advise accordingly as we see the numbers currently. Our advice from our epidemiologists is that this is isolated clusters, which must just be contained in terms of contact tracing, quarantine and isolation, and treat those who get sick. But at this stage, we should not over panic, for instance. So I'm just giving you an example of the approach we'll be using.
No, absolutely, Minister. I'm very excited. I got my 2nd jab yesterday, and I got my digital vaccine certificate, only to read some reports that our barcode on that digital certificate is not recognized in parts of the world. How is the Department of Health going to deal with? Because ultimately, people are traveling, and if our vaccine certificates aren't recognized, that's going to pose as a huge issue.
Well, that's a subject of negotiation. We equally also get approached by various countries to recognize their certificates. We have to just get our technical people to interrogate the protection and safety measures in those certificates. We also have to, at multilateral bodies such as European Union, G20 and BRICS and so on, we have to negotiate sometime just bilaterally with individual countries. So this is a matter which there is no currently a uniform recognition of every certificate. So we have to take it country by country, a group of countries by group. But we also optimistic that as we improve the certificate, we did say even from the beginning that by the end of November, we will have been able to improve it to such an extent that we will be able to convince most countries that they should recognize our certificate. So our team is working around the clock to make sure that as November comes to an end, we will have enough safety measures to can get it recognized by the majority of countries.
Another issue that has to be recognized, Minister, is the issue around booster shots, especially when it comes to our health professionals. And it was reported that Pfizer had applied with SAPRA for approval for that booster or emergency shot. Why do we have to apply when Pfizer is already in use in the country?
Well, every medicine, not just starting with vaccines, every medicine, when you apply for approval, you have to indicate the dosage, how it's going to be administered, over and above the safety and the efficacy. So when you apply to say a Panado will be taken by an adult, 2 tablets every 6 hours. If you're going to change to say now it's going to be 3 tablets every 6 hours, you have to show that it's safe, that it can be used with an amended dosage and frequency. So similarly, when you deal with vaccines, because when SAPRA approves, they don't just approve to say this is the name of the vaccine and it is approved. It's approved in detail, how much for what age group, and what is the dosage, what is the frequency. So if you are approved as a 2-dose medicine, like I'm saying, even just with the Panado, you can't just change midstream. You have to supply information to show that indeed it's still safe to can add an additional dosage. So that's why it's important, not just for the vaccines, but for every medicine.
Minister, we have run out of time, but I've got 2 questions for you, and I'm going to ask you to be brief with your answers. The first question is around the booster shots. How is that program going to be rolled out? Are we going to start, as we did with the initial vaccine rollout, with health professionals and then citizens, or can anybody go for a booster shot as soon as they're available? That's the first one.
Well, at this stage, as you might be aware, we are on the Sisonke 2, which is only for health workers with the Johnson & Johnson. That's what is approved as a study, research, to see how this works. So the operators of that South African Medical Research Council has received an approval. They will be doing that with the health workers. They will be reporting on the outcomes. Based on that, then there might be a rollout to the public, to general public. Similarly, Pfizer or any operator of Pfizer can apply. As you said, they have applied. That will be looked at by SAPRA. And if it is found that indeed there's enough information, maybe not just in South Africa, but information from elsewhere, that can be approved. And when it is approved, then we would then implement according to the approved rollout. I mean, according to the specifications which have been approved by the regulator.
Yes. And then my final question to you, Minister. It is the festive season. We do expect a lot of tourists from Europe, the likes of the United Kingdom, visiting our shores. And of course, they carry the likes of the Delta variant. Are there any concerns around that? What's keeping you awake when it comes to managing the variants as we expect an influx of tourists in the festive season?
Well, it's a big dilemma, because we do want tourists from abroad, from all countries, whether it's Asia, America, Europe, Africa, everywhere. Our country, our economy will do better with more tourists coming with foreign currency. But of course, as you see the 4th wave already raging in Europe, we do get concerned. That's far what at least is sort of comforting is the fact that we are not aware of a new variant. They're still talking about the Delta, which is already dominant in South Africa. So we will take all the necessary precautions as every other country is taking in terms of vaccination certificates, where we have bilateral agreement, also COVID testing results, fresh results, 72-hour results also will be recognized. But more than worrying about the tourists, I mean, we would like the tourists to come with all the precautions. Just take precautions. I think the fact of the matter is that this virus is going to be with us for a very long time. So we just have to adjust safety measures of how we live with it. But what I'm more worried about is local, in terms of too many gatherings, big gatherings with no safety measures. As you have said already, flu is already spreading, influenza is spreading, because less usage of masks. So those are the things which worry me, and I just want to, again, we're going to be making continuous appeals to all South Africans to continue to observe the safety measures which are well known.
Minister, thank you so much for being kind with your time this morning. Minister Dr. Joe Phaahla joining us to speak about COVID-19 and really what keeps him awake at night. And of course, it's that fourth wave and South Africans neglecting their protocols in terms of social distancing, wearing their masks and just taking basic precautions against that pandemic. Still to